Diagnosis involves a comprehensive evaluation, including blood and stool tests, upper endoscopy and colonoscopy with biopsies, and small bowel imaging. Blood tests. Complete blood counts, inflammatory markers, and albumin are the most important blood tests in IBD evaluation. Complete blood count may demonstrate anemia, or low red blood cell counts, elevated white blood cell counts, and elevated platelet counts. Systemic inflammatory markers, known as ESR and CRP, may also be elevated. Albumin, which is a protein found in the blood, serves as a marker of nutritional status and may be low in patients with IBD. It is important to note that normal blood work does not exclude the diagnosis of IBD, especially in mild cases. Stool tests. It is important to perform stool cultures and C. difficile testing to evaluate for infections that can cause intestinal inflammation and diarrhea and mimic IBD. Stool is also typically tested for blood and calprotectin, which is a marker of intestinal inflammation. Upper endoscopy, EGD, and colonoscopy with biopsies. This is the gold standard testing for IBD diagnosis. EGD allows for evaluation of the esophagus, stomach, and the first part of the small intestine, called the duodenum. Ileocolonoscopy allows for evaluation of the colon and the terminal ileum. The endoscopist will look for inflammatory changes that are suggestive of IBD, which can include erythema or redness, friability or tendency to bleed, ulcerations, exudate or pus, and loss of typical blood vessel pattern. They will also take small pinches of tissue, called biopsies, which a pathologist will look at under a microscope. Ultimately, this allows for characterization of the location and severity of intestinal inflammation, which helps with treatment selection. Small bowel imaging. The small intestine between the duodenum and the terminal ileum is not accessible by standard EGD and colonoscopy. Therefore, small bowel imaging, such as MR enterography or CT enterography, is often recommended for assessment of small bowel inflammation.